is Amanda Hansen. I am Senior Director of Pharmacy with Cleveland Clinic. My training began not in pharmacy. I went to Virginia Tech as an undergrad, not really sure what I wanted to do. Ultimately ended up at Virginia Commonwealth University for pharmacy school, and then at Johns Hopkins for my PGY1 and PGY2 in infectious diseases. And then several years later, I went back to school for a master's degree in healthcare administration with VCU, Virginia Commonwealth University. I was inspired by people that I worked with who were in healthcare to be part of pharmacy. I always knew I wanted to be involved in healthcare. There was a part of giving back in a very deep and meaningful way. And I had an opportunity to work with pharmacists who were volunteering at a free clinic in my hometown and really realized how much they loved their work and the variety of work that it gave them as well, and realized that it was a perfect alignment for my interests and a good balance as well. There isn't a typical part of my day, which is why I love it. I love my atypical days where every day is different. I love the atypical practice that I have. What I get to do every day is around staff development, practice advocacy, and clinical research. So I work with people in all walks of healthcare, not just in pharmacy, which is a big part of why I love it. A typical day could be meetings and connecting with folks on grant proposals, working with politicians in our state, working with our government relations team, our legal team to move practice forward, to advocate for our patients, and then working with a wide variety of caregivers in our organization. So working on their development and ensuring that they're moving in the direction that they feel is best for their career. Favorite part of my job is an opportunity to work with people from all walks of healthcare, folks that are helping patients, folks that are helping those who help patients. I love the opportunity to connect with individuals within and outside of pharmacy, that diversity of ideas and perspectives, and each of those opportunities gives me an opportunity as well to really sell folks on what pharmacy can do. Our pharmacists, our pharmacy technicians, the talent that we have, how we can really move mountains when we work together. I absolutely love that part of what I do. And when I first started in my career, I was working bedside and absolutely loved that impact that I made. And now moving into a leadership role, I have an opportunity to influence practice on a much larger scale. And I walk away each day knowing that I'm making some real difference. That's very meaningful for me. My advice for someone who's interested in a career in pharmacy is just to say yes. If you've got an interest in healthcare, if you've got an interest in leading, not leading, helping patients, working collaboratively, what I found is what I was told originally when I came into pharmacy school is that this career can take you anywhere. And I think that it's such an incredible opportunity to be able to explore any walk that you possibly can. Where I am right now is never where I thought that I would be, but I couldn't be happier with my role. And it's not one that I ever would have imagined early on. And I think that saying yes to those opportunities that come your way, it's a project, it's a chance to work with someone, saying yes to volunteer opportunities really opens doors and can take you where you would not even imagine.